Hi, I'm your host, Erika Polsinelli, and welcome to Evolve by Erika, the podcast, where we talk all things spirituality, ascension, health, wellness, and beyond. I'm so excited that you are here. Come on in. Hello, team. We're here today with Dr. Natalia Rappa, who's been a long time Evolve member, and she's someone that lives in my community. She is a psychotherapist, and she teaches or guides or facilitates a few different types of therapies that she's going to talk to us about today. She just recently really honed in on working with people through their trauma, which I definitely wanted to talk about here. I think we do a lot of this work in the subconscious with Kundalini, and I love being able to see how all of these offerings really bring us to the end result. And it's all about just finding what's going to work for us, finding the space that we need to feel supported, held, in order to really live a freer, more aligned life. So in this conversation, we talk all about the different forms of therapy that she practices and facilitates, and how it can impact us, and how some things kind of overlap, the Kundalini practice and therapy, different forms of therapy. And I think you're just going to walk away learning so much, maybe feeling inspired to try some different things in order to unlock that highest potential that lives within you. So I hope you enjoy the episode, and I'll see you on the other side. So excited you're here. Thank you for making the trip.
Yeah, me too. Thank you for having me. Yeah.
I loved when you reached out because I feel like a lot of your work embodies the work that we're doing spiritually, but in more of a therapy setting. And
exactly.
I think with your experience of Kundalini and practicing, you can kind of like bridge some things for us, like what we're doing in your terms, and maybe what you've experienced with the practice, but also how you work with people in the psychotherapy aspect, and just sharing some different strategies and skills and tools that we can have in our pocket, because I know you really focus a lot on trauma. So I want to go there. I want to go there and go deep. So just take a moment to introduce yourself to the community. You know, they're going to be so excited to meet you and connect.
So my name is Natalia, and I technically, in a professional sense, I would be Dr. Rappa, but most of my clients call me by my first name. But I would say a holistic psychologist is really like the way I like to talk about what I do. I have a background and a doctorate in clinical psychology, so technically that's the background. But I really incorporate like a couple different techniques into what I do. I use cognitive behavioral therapy, but then also integrate some mindfulness, and then also this trauma treatment that I recently became trained in and started integrating in, and that is called EMDR. So you may have heard of it, maybe not, but it stands for eye movement, desensitization, and reprocessing. So ultimately, I found that the clients I was working with, there was like a block happening where like we would start working on skills and tools and a lot of what we talk about, right? But it was ultimately this sense of like they knew what they were supposed to do, like they knew the tools, they knew all the things, right? But they couldn't apply it, or they didn't really actually feel it, right? Like embody it, right? And feel it to be true, all these things that they knew, right?
It's so funny you're bringing this up, because this has been the theme of today. Like this is what I've been talking about. While I was driving in here, we were stopped, like we parked the car, and I was like, I just need to record something about this. And then in the previous podcast I just recorded, that came up. And now it's like this theme of the embodiment aspect, and knowing all the things to do, knowing all the things to be saying in your mind, the positive affirmations, all the things. But where the magic happens is when you actually can feel it in your body. And sometimes there is that disconnect. Like you know when you're connected to that, and you know when you're not. And when you're not, it's like, I am happy. I
Right.
am abundant.
Right.
And then
I'm
when
say
it
the
is,
affirmations.
it's like,
Yeah.
I am abundant. And you're like feeling it and connected to it. And you're living it and you're vibrating it out. But there is a difference.
Yep.
So you're seeing this with the clients you're working with.
Yeah. So I just started to notice like clients I would work with for a longer time. I was like, something is off. And I got like guided really. It was like the kind of thing that was just like, you should go into EMDR. I never heard of it before. I really didn't know much about it. I heard a little bit of it, but I was like, I should get trained in this. And then I realized that it's funny because we just went through, right, like a global like trauma of COVID. And then everyone started getting really into like walking, right? And walking became like this thing. And EMDR was actually founded on the effects of walking, right? What happens when you walk is your eyes move in a particular way. So that movement, the founder of it noticed that when she would go on walks, she would be able to process things differently. And so she was like, let me look into this more. And she ultimately wound up doing research and studied with veterans and developed this technique, which is now EMDR. Which really uses the eye movements. So similar to like what happens during dreaming, like rapid eye movements. So using those eye movements or bilateral stimulation, basically the stimulation of the both sides of your body and your brain. So you use tapping or follow lights or follow dots on a screen, but ultimately it helps to bridge the parts of your brain that are like the parts of like, I know on a cognitive level, right, versus the emotional processing parts of your brain. Because when you go through trauma, it gets locked in that emotional almost state form where it's in that place of that emotion, that sensation, that however it happened, it gets locked there. And in order to access it again, right, a way to do that is through this technique of opening up that channel. And then, but I think what you said is important, right, of like embodying. Yeah. But I think what people don't want to know or want to do is you often have to go and embody and feel all the things that you felt when that came up that were really hard. Yeah. Right. In order to open up that channel and then kind of start to use, bring in, EMDR brings in what are the positive, beliefs you want to believe about yourself, right, in relation to this thing that happened to you. But you can often almost only do that by opening up what happened originally, like that original wound. So it's painful in the beginning. It brings up a lot of emotion, but it really is so powerful, and the effects of it are so much quicker than a lot of typical like talk therapy. And you don't have to necessarily identify as having trauma. You could just be dealing with anxiety or depression or something where you just feel stuck. So it's really cool. Yeah.
And it makes sense, like then going into the space and then replacing it with like the newer thought, the more positive thought, belief, frequency. Yep. And needing to create that space in order to do that.
Yeah,
they both
exactly.
can't live there.
Right. Yeah.
Yeah. So it's so interesting that this was developed based off of walking, because I walk every single day. Yeah. Always walking. Yeah. And sometimes a lot of like ideas will come through when you're walking, or if you're in a bad mood and you go for a walk, especially near the beach. Yeah. Gratefully, we get to do that a lot. I know. It's hard to stay in a bad mood when you start to move and you start to walk and you start to like take in nature. It really helps to connect and bring in that level of embodiment.
Yeah. And it's based on that, like this technique is based on, right, I think what you believe to be true also in this idea of it's called the adaptive information processing like model. But basically the idea is that our body and our minds want to heal, right? Like they want to move towards a more adaptive view of something. So when you're walking, when you're moving, you almost naturally come to like a solution. Or like when you do the eye movements, it's so interesting to just see clients like naturally come to this place of knowing what it is that they need to hear, what it is that they need to believe. They know it. Like I don't have to tell them or implant some positive affirmation. Like it's already there, because that's just what our you know, what our system is meant to do. Like,
literally.
So it's,
like that
it's so cool.
self-realization.
Yeah.
And it really goes back to everything really being within us and just finding the tools and the supports that are going to help us bring ourselves into our most at home, or you could say elevated or natural state of being.
Right.
And it's just trying to find a way to move that and uncover it.
Yeah.
So when you work with people in this way, they tell you a specific trauma or something that they're working on?
Sometimes they come in with just like anxiety and different things, and it'll be almost these like presenting issues that are current, but we can a lot of times use a current issue also to then do what's called like a float back, where we break down what's happening now, and then we kind of use those words, sensations, like emotions that come up from that present issue, and then we'll have them almost say, okay, like bring all that up, right? And then I want you to float back to an earlier time in your life, right? And it's instant how people can be like, oh, I'm there, right? Like I'm in this place, or I don't even remember this, and now it comes up a lot of the times. So it could go that way, or someone could be very clear, like I had this trauma that recently happened or happened when I was young. But
it's so fascinating to me how, first of all, what a time. Like we have access to so many tools and resources, and it's really, as much as it might also feel overwhelming to some people, like, you know, like, should I do this? Should I do that? Should I do this? That's where our intuition comes in, and that's why it's so important to have it, so that just like you knew you needed to get trained for this, we can know as a collective like what tools we need to move through it. But it's so interesting because I feel like the practice that I've had has helped me to have those moments of like, oh my God, this is where that started.
Yeah.
And then you're brought back to that. Yeah. So my question is, in those moments where you're brought back or where your clients are brought back, does that bring in a level of healing by just recognizing how it originated?
Oh yeah. Yeah. Okay. Because then you can start to be like, oh, like a good, like a kind of quick, I feel like tool or thing that I'll use with people too, once they realize that, is just like, how old is this? Right? It's like this little cue of like, you feel it and you're like, it's a way of separating, right, from the emotion, from the thought, and being like, how old is this? Right?
So like 8 years old, if it was at 8 years old,
or just like, it could be how old I was
20 years ago.
Just in general, not that they have to have an answer, but almost to say to themselves, how old is this? Oh, okay, this is old, right? Like this is something that comes up for me a lot. This is something that is originated, right, when I was younger. And I know that it's an old, right, or a younger, right, version of me, so that they can kind of start to acknowledge like, oh, okay, I see that. And that's like that path, right, that I always take that, you know, is kind of easy to fall into, right, that old version. But I can notice it now and know there's another choice, right, or like another option. But in order to, you know, do that, they have to, you know and be like, oh wait, this is where this came from. And now I can realize maybe how I blamed myself for whatever that was that happened, or I, you know, treated myself or spoke to myself really unfairly. It's usually you're pretty young a lot of the times when it happens, and it makes sense because when you're young, your parents or people around you, you're like, oh, well, you're my foundation of everything, right? So if I feel off, I'm not going to question something's wrong with me. I'm not going to question something's wrong with you. I'm going to question something's wrong with me, right? Like if your parent or whoever is dealing with whatever, mental health or whatever it is, you're going to look and say, oh, okay, like, especially if you're sensitive, which is a lot of my clients, like highly sensitive people. That's
what we were just talking about on the way here. I'm like, why do I have to be so sensitive?
Yeah. Like that's me. And that's a lot of my clients being highly sensitive. And then also maybe having parents who've had their own difficulties that you internalize it. You're like, oh, this is about me. And then to realize later and to see it and to sit with that compassion for yourself, right? Of like, oh, wow, like I really internalize that, and that really wasn't ever about me. To be able to say that and see that, and then start to.
Can you give me an example?
Yeah, I'm trying to think of a recent one. I have if a client is, let's say, like they're in a household, right, where they have parents who have ultimately told them when they're younger, right, like you have to kind of like keep things together, right? And like not really bother us with your stuff kind of thing. Like maybe there's another sibling, right, that has a lot of needs, let's say.
Yep.
Right. And they can kind of ultimately internalize that, right? As far as like, okay, well, I'm not, you know, I'm not worthy of, right, that attention or that love, or maybe it's not safe, right, for me to share this because I need to be small, right? I need to kind of not cause any more problems. So ultimately they'll internalize that, right, as being maybe either something's wrong with me or like that I'm not safe, right? And they'll start to then internalize that into what they do in their daily life or with friends or with family, right? As far as just like, okay, I'm not going to share, or I'm not going to, pursue those types of connections that I really want, because I don't feel safe, like, to do that. So ultimately then, right, then they can go back and realize and say, oh, okay, like that wasn't maybe fair, right, for my parents to put that level of responsibility on me as a child, to almost feel like a lot of times in that situation, you feel like, oh, I'm responsible also then for my sibling or for someone else's behavior. So if they're getting upset, like, oh, I need to try to do something to control this or help this, right? And that was never in your control. Right. So that's ultimately what a lot of trauma is about, right? It's like taking that ownership about something that was never in your control to begin with.
Yeah.
Right. And being like, oh, okay, like I wasn't responsible for that. Like I can let that go. Like that wasn't about me. I don't need to hold that. And that's right. We're usually holding like other people's stuff.
So true.
But it's hard.
And it's so wild. Like if we could zoom out and look as like a bird's eye view of how our trajectory is so determined by our past and our childhood. And if we're not doing some type of this work, we just stay on that same path, which is fine if that's some people's dharma or destiny or goal or fate or whatever you want to call it. But it could be super empowering to be like, whoa, I could create a whole new future for myself. I could create a whole new path for myself if I find the work that works for me.
It's amazing to see like clients who I've worked with for longer where I'm like, wow, let's step back and like look at where you started and where you are now and the things that you're doing now. You would never like I would never be seeing myself do these things. So I think it's just so, it's so powerful and so like an honor to get to see that, to see people make that transformation.
Totally.
And that it's like really possible, and a lot of times I'm like, you did that, right? Like I held the space for you and gave you some tools, but you really, especially with EMDR, it's very much about me not intervening as much as possible. A lot of it is them bringing up an image, them sitting with that image, and that's how it works, right? You kind of create a picture with them of ultimately.
How do you facilitate it? Can you step us through it?
Yeah. So ultimately you create what's called like targets. So you identify like certain memories that seem to be more, upsetting or distressing. And you pick those, and then you will start with whichever one makes sense, and you agree. It's always about agreeing with the client on like where they feel comfortable, but starting with that, and then you bring an image to mind of whatever the most painful, like challenging part of that is with them. So you'll say like, okay, let's make a picture, make it really vivid. Again, like bringing in all your senses into it, and whatever the picture is of that memory of that challenging part, the most challenging part, they'll develop. And then once we have that together, I'll walk them through that, and I'll repeat the image to them a lot. It's similar almost also to exposure in that like I talk them through that image a lot so they hear it a bunch of times. And then we'll walk through what are like the beliefs around it, the positives, the negatives. How much do you believe the positives, right? Which is a big part of it. Like how much does it feel true to you? We use the word feel a lot in all of our questions with clients. Of not like, what do I think is true? What do I embody, right? Like, what do I feel? How true do I feel this to be about me? So we do all of that, and then we create, that's like our target with all that information about that memory. And then we take that memory, and that's kind of like our baseline about it, right? And then we'll do these sessions where we'll bring up the picture, then I'll have them do the eye movements or like tapping. And then they'll just start to pull up almost whatever comes. It's almost like free association a little bit, but whatever comes up, I'll pause them every so often. I'll say, what's coming up now? They'll tell me. It could be a new image, it could be an emotion in their body, it could be whatever. And I'll say, okay, we'll check in with it. And then I'll say, all right, let's go back into it. And they'll continue. And I really am just a guide there. Like, so as I pause them, to just help them sometimes plug in a tool or redirect them, but really I do very minimally. And then ultimately it could be a couple sessions. Sometimes it could be one session where they'll get to a place of resolution about it, sometimes like on their own ultimately, or seeing it in a new way. Or sometimes they'll leave and they'll have like dreams or connections they'll make between sessions. And then that brings up more work for us to do, or it helps them to understand it. But it's really like very cool to witness and see, cool. And like just, and organic. It's really not, it's like using, again, like what your body and mind are meant to do. So
could this be facilitated as a group, or it has to be one-on-one?
I think right now it has to be one-on-one. When I got trained, I asked them about it because I was like, how do I bring this to people and share this with people? And I've like done pieces of it. I just started doing, offering some groups for support for women like in their fertility journey.
I want to talk about that next too,
But I started bringing it into that a little bit because there's so much trauma that happens in the fertility conception world and process. And I know from experience. So I was like, let me try to add this in, but it's not like formalized to do with a group.
Sounds really cool too.
Yeah.
Recently with the Evolve community, we did a hypnosis. It's reminding me a lot of that.
Well, yes, honestly, it
like,
isn't hypnosis, but it has a lot of similarities to hypnosis. I think people get freaked out by hypnosis, but it's very similar to it. Yeah.
Honestly, like everything that we're doing is so similar, and it's just like different ways and avenues and techniques to help us get to the same space of like that realization and that healing. But it really reminds me of the hypnosis a little bit, like the process of it, of remembering, retrieving that memory, thinking about how old you are. So I was just thinking how cool this would be to do as a group too. So if you ever feel guided to it. But so with fertility, what guided you to start working in that area, and what kind of work are you doing there?
So I had my own journey with fertility, as far as, and everyone has one, but I ultimately was like really serious about getting like my body like healthy and good, whatever. I was on birth control prior. And I was really like on birth control for way too long, or as too long that I thought I was, but I was really in that fear state about it. And like, if I come off of it, what's going to happen? I've been on it for so long, blah, blah, blah. So I really, once I knew that I was going to really try and be open to having a child, I was like, I really want to try to balance myself and come off of this and not immediately go into trying to have a child, which, if you do, fine. But I was starting to read and educate myself about what is the kind of hormonal state I want my body to be in when I have a child, rather than, all right, let's just go off of this and then immediately start. So I did that, and I was like pretty fortunate as far as, that process coming off the pill and everything. It was pretty smooth. And I followed like a supplement protocol and certain things. And then I wound up getting pregnant pretty quickly when we started trying. And then like, it was 8 or 9 weeks, right? I went back to the doctor. They were kind of like, it's a little early for whatever. We're not sure. Come back. And you don't know, like, whatever when you're in it. And then I came back the second time and there was no heartbeat, right? So I had to have a DNC. Thank you. I actually remember meeting with you after that. Like, we did an individual.
Okay.
Yeah. So I was like distraught about it.
I remember.
But I was, it's something that happens. It's so common. But I was like, I decided to be open about it, like to my friends, and then like to like Instagram, all that. And then I was so surprised at like how many people that I knew, right, that had gone through a miscarriage, right? And I didn't even know that they did.
Yeah.
And I was like, what? And then even my husband's family, some of his aunts, like all these people started opening up to me about it and being like, oh yeah, I did too. And it, I would have never known that. So I feel like there's such shame, like on a societal level about it still. So I just was like, what is this, right? And then I had my own journey to go back into being open to trying again and going on that path. I wound up conceiving like my son, who I have now, who's the best thing ever. But it was, a process. And even when I was pregnant with him, I still felt that, it was like, I know I'm pregnant, but there was still that feeling of like, what's going to happen, or, that you carry with you even after you actually do conceive. So I was like, this is like a area that's so missing and like needing support.
Totally.
And I was like, we need to do something. And I started like coming up with ideas with another woman who does Reiki at the Nesting Place, which is a place that does like a bunch of support for women prior and then after birth. So we set up like a group together to offer space, and we called it like the kind of reclaiming your conception journey. So we started that group together recently. We did one session. Beautiful. Yeah. And it's interesting how it kind of bridges my training, right, with like the trauma and all of that, and my own personal experience into conception work. It just makes sense for me. So
that's so special
where it goes. It's needed.
And through that, are you using that technique?
So with that group, I did a little bit of some of the visual, like the images and bringing some of that up, but we really did like a one-time thing.
Got it.
After it, I was like, we need this to be like a whole series. Like this needs to be a long thing, but let's test it out first and see how we feel. But the women that were there were like, okay, like, so can we come here like every week? And I was like, I would love you to. I don't know how we're going to do that, but sure.
Was it in person or online?
Yeah, it was in person. Yeah, which is also so nice.
Yeah.
Like, there's like such little things in person now.
So nice.
Yeah, so it was good. Yeah. Wow. So we'll see. But yeah.
Wow. Thank you for sharing your story too. And I'm sorry for the loss.
Thank
you. It's just, some things just don't make sense sometimes, but the wisdom and the strength that is created in those moments really come in and help us to guide and teach and share and heal ourselves and others. Wow, it's such important work that you're doing. I'm like interested. I'm like, I want a whole session. I want a full session with you to experience it for myself. Because a lot of the work I've done has been really through Kundalini. I feel like I've received years of therapy through it. But every phase of your life calls for something different and or something else is coming up. And it's like, how can I transcend this and move this? And it's just so great to have the knowledge and know that there are so many different tools and resources. And I hope that by sharing this today, if someone is listening and they're like, oh my goodness, that sounds like exactly what I need right now. And it could just help. The smallest shift can take place, but it could be the greatest shift at the same time. Like just one little perspective change.
I've seen it even just doing just the beginning part of it, of being like, oh wow, we didn't even get into the work of it yet. And I could start to see that shift that happens just from the awareness piece, right, before you get into anything else, of just being like, oh wow, like I can see that, I could step back and see this differently. But life transitions that's a big part of like an area that I like to focus on, is people that are in life transitions, because life transitions are where, right, a lot of trauma comes back up or resurfaces, or things happen where you're like, oh, right, you feel uncomfortable because you're going into a new space, so it all comes up again. So wow, we can talk,
so powerful. And that aspect of the shifts, like you holding space for someone, sometimes we just need to be like, I'm ready to heal this.
Yeah.
And I'm committing to this. And then they have the person to hold the space where they feel safe. And just when you said, like, we haven't really even gone deep in the process and already I'm seeing a shift, but that's how powerful it is to be like, I'm ready to change. I'm ready to heal. And I feel safe and secure in this container to do so.
Right. I think that's the biggest piece of it with any therapy, but especially this is you really make sure you feel, and there we actually do exercises in the beginning around creating a safe place, creating like imagery around this like safe place, but really you have to feel safe enough with me, right? Or safe enough with the therapist you're working with to feel like, okay, like I can go there with you, because there's plenty of people who won't go to that emotional place in therapy. That's where, you know, the work is. And when it happens, I'm like, okay, like this is going to come up, and it's kind of like, you know, if you reopen a wound or a wound is not healed properly, it's going to kind of like ooze out, and that sounds gross, right? That's not fun, but that's part of the healing that a lot of people don't, you know, it's hard, it's painful. And I always am like, that makes sense why you wanted to avoid that, or why you do avoid those emotions, because they are really painful, and they're painful because they're historical, right? Like anything that feels like it's hysterical or too intense for the present stressor is because it's likely, right, historical. It's not about what's happening now, right? It's about what's happened however long ago, or multiple times if it's little traumas, but it's painful.
If someone experienced one really big trauma, would you have, like, what would be like your go-to Rex?
If it was a one-time trauma.
One-time big trauma.
Yeah. I mean, as far as in therapy itself, if you're working in therapy, I mean, it would be one really about making sure you start to develop some ways to regulate yourself, some ways of self-soothing, you know, grounding, any of that. Like that's a lot of the work we do in the beginning, is making sure you have a really good tool, you know, box of things to really feel grounded and safe. Because if you don't have those, and then we start to try to open up the trauma, then it could, right, kind of cause you to almost pull back more or feel too much of that at one time and not feel like you have the tool. So it's not about just like flooding yourself and throwing yourself in. I think you really need to have certain grounding tools. And like, luckily I had your breathing exercises, all of that, all the Kundalini tools, which I think integrates a lot of, right, like body and mind and breath and mantra. So having all of those first before, and having a safe relationship, right, with your therapist or whoever you're working with is really important, because part of the healing is just in the relationship. I mean, a lot of our traumas are relational, or about how someone else treated you. So having someone who's going to offer you that like unconditional space, right? Making sure you have that, making sure you have the tools before you get into it.
Yeah. Because when you unlock something really big, like I think people would probably fear how long am I going to be like, I'm thinking of that term that like if you get a procedure done, it's like downtime. Like how much downtime am I going to need? Right. Like am I going to be able to like resume life as usual tomorrow, or am I going to be like taken by this wave? And is it different for it's different for
everyone. But it's definitely something that we talk about as far as like, okay, one, you know, you can't, there's never going to be a perfect time to work on stuff, right? Of like, there's nothing else happening in your life. There's no other stressors. Right. Of course, there's life, but being conscious and aware of like having the support systems around you, making sure you don't have like big deadlines due, things like that. And also, like really taking care of yourself afterwards, not scheduling, especially for like the day after or right after, like to really make sure you create space for yourself. Because it is like surgery. I mean, a lot of the people that I've trained with talk about it like it being like almost psychological surgery, right? So afterwards, really being mindful of that and giving yourself that space to really rest and care, and then usually like I'll have a system where clients can check in with me if something feels like it's too much. So you have that support also, but yeah, you need the downtime.
Totally.
For sure. Yeah.
Yeah. And I'm sure that's what can like bring up a lot of fear for people to be like, do I really want to unlock this?
Of course. Yeah. Well, because it makes sense, right? Because if I want to unlock, I don't want to unlock it I'm going to feel the things that I'm always trying to not feel because they're so painful. But I think that's where so much of the education and the awareness in the beginning helps you, give you that sense that we do a lot of metaphors too. So we develop certain metaphors that you use, like whether it's, you're on a train and everything that you're noticing is passing, right? Or you have the remote, right? And there's a TV and you can shut it off at any time, right? A sense of that this is not you, right? This is something you're experiencing, but it's not who you are. And you also have the ability to take space from it if you need to. So we develop all of that before. So you're like, we know what your metaphor is. We have a safe place. We have the tools, like, so that when you go into it, you really feel empowered to sit with it.
Yeah. And
be able to come back to like, you're here, right? You're here and you're watching that pass. So that's a lot of the language you use when we're going through it is like, it's passing, just notice it, right?
Yeah.
That's a lot of the words and stuff that I'll use is like as I guide people. So yeah.
My Kundalini teacher, I shared too about the train as well.
Yes.
And it's really helpful in moments where you're like, when you're just in like a hard time. To think like you're just passing through this time. Because when you're in it, you just feel like that's it. That's like the end all be all. You're like, this is it.
Yep, we're done.
That's
we're done.
it. Like this is it.
There.
This is the new reality.
Yep. Never
and
gonna
it's
feel
like,
like
no, you're truly just passing through. And whether it's just our current situation that we're feeling, or if we're going back in like in your work,
right?
Just having that metaphor, I'm sure, is so helpful because it's been so helpful to me too. It's like, no, we're just passing through, and everything is so amplified by the thoughts we put behind what we're experiencing or what's coming up.
And because our mind is so powerful, right? It's like if you have the thoughts, your mind doesn't know the difference between what you're imagining and what's actually happening. So which could be used to our benefit, right, in this kind of situation, to go back and be like, wow, I can bring myself back there and plug in things in a different way, right, and like rewrite it.
Exactly.
Right. But I can also, it can feel like it's happening now, right? If I like have that, any of those thoughts, it brings you right back. So
or that it's like going to be forever. And what we're experiencing now is not forever.
Well, that's why I think also, those beliefs that are developed or come in when you have a traumatic experience, right, are kind of like, well, this brought this back up for me. And this just is more evidence that, I'm not good enough, right? Or something is wrong with me, or I am bad. Like, so that's where it's like really getting to the root of it, which is like what I like to do. I'm like, let's get to the there, like let's do it. But it's not, it definitely takes preparation and like a care around it, because it's really led by the client, like the pace of it, like you're saying, as far as like how long, and like that's so different. The downtime and everything for everyone is different.
How long are the sessions typically?
Usually like full processing sessions are usually more like an hour and a half.
I was thinking more than an hour. Sounds like really deep work.
Yes.
This was so helpful though, and it's just so interesting. I love being able to share and hear and learn about different ways to be able to access what's on the other side of whatever difficulty we're going through in this now moment. So it was so helpful. Where can everyone find you if they're interested in your work or following you on Instagram?
So on Instagram, I'm at Talking Dr. Tal, so Talking DR and then TAL. And then all my information in my bio is there, like linked to my website as far as setting up consultations and all that. Amazing. Thank you so much for having me.
Thank you so much. Thank you guys for listening in. I hope you enjoyed. I'm going to link in the show notes Dr. Natalia Rappa's Instagram. And then from there, you can find everything in her bio if you're guided to explore a little bit more of her offerings. But I feel so clear about the different types of therapies that are out there. I know I did one also on CBT that you can go back to and listen to as well if you're interested in more of the therapy talk or just hearing different outlets, different means to get to where we want to be. Thank you so much for listening, and I can't wait to see you next time. May the long time sun shine upon you. Sat Nam.